Liver health is often overlooked, but it's crucial for good health. Tonight, hepatologist and gastroenterologist Dr. Supriya Joshi joins us to talk about the connection between liver disease and obesity and how we can improve our liver health. Before we get started, tell me in the comments where you're watching from and let us know if it's your first time joining us. Dr. Joshi, thank you so much for being here with us.
Thank you so much for inviting me. I'm looking forward to talking to you about this topic I'm passionate about.
So I'd like to start by talking about what the liver does for our health and why we should care about keeping it healthy.
So many people used to think that liver was just a filler in the abdomen, but it does so much more than that. So people often think about it as having a role in digestion, and that's correct. So the liver produces, metabolizes many things that we all need to live. So first of all, it produces bile, which is an important enzyme for digestion. It is important in detoxifying our blood, depending on what we eat or drink or consume, but also for toxins and medications. And in addition, it's important in filtering things and producing clotting factors and important proteins as well that we all need for life. So it is important to be kind to our liver. And another very important role that's recently getting attention is its important mechanisms of action when it comes to glucose and insulin metabolism.
So can you explain the connection between obesity and liver health?
The connection is that most people with obesity, more than 90%, will also have liver fat or fatty liver. And that's the most common liver disease associated with obesity. So I'm pretty sure that's what you're targeting or questioning me about. So with people who have fatty liver disease, we know that people with obesity who also have type 2 diabetes and high blood pressure and have increasing age are the highest group of people to have progressive liver disease from fatty liver. And that means the liver is fatty, but they're also having increased risks of progressive liver fibrosis or damage. And that eventually, over many years, can result in a condition called liver cirrhosis. So it's important to realize that many people think, oh, alcohol is the big cause of liver cirrhosis. But it's not just that. In fact, fatty liver disease is now almost the #1 cause of liver cirrhosis, along with alcohol.
We're going to pause here and do our trivia question. If you answer our question tonight, folks, you'll get a collection of recipes for sheet pan meals. These recipes offer a simple, time-saving way to prepare healthy, flavorful dishes with minimal cleanup. And you'll get those recipes for free if you answer our trivia question, which is, true or false, strength training can increase bone density? Is that true or false? Can strength training increase bone density? Put your best guess in the comments and you will get those sheet pan meal recipes delivered to your Facebook Messenger inbox for free. And folks, if you can think of any friends or family members who might find this show helpful, please tag them in the comments so they can tune in too. So Dr. Joshi, in 2023, a new name was announced for what was traditionally known as fatty liver disease. Tell us what the new name is and why the change was made.
So the new name is called MASLD, or MASH, which stands for Metabolic Dysfunction Associated Steatotic Liver Disease, for someone having fat in their liver. If they have the inflammatory fibrotic pattern of the disease, it's called MASH. So Metabolic Dysfunction Associated Steatohepatitis. And it's MASH that can progress to liver cirrhosis. So this was very appropriately renamed because a former name, as you've said, was called fatty liver disease, but it was also called non-alcoholic fatty liver disease. Those are the two forms that we would label patients with. And we realized that it didn't really connect to the cause, and it was very stigmatizing. So those two were recognized as major disconnects. So the plan is, and the hope is, by giving it an appropriate name that connects it to the etiology or the cause, and what could happen to patients if they have fibrosis, that this would lead us to a better understanding for who has what problem and how we can treat them best.
So you've mentioned several different forms of liver disease. Are they all related to obesity?
The answer is no. So when it comes to liver disease, there's that MASLD that we just talked about. That is the one that's related to obesity. But there's a whole bunch of other liver disease that your digestive health specialist will be trying to assess for. So alcohol is also another type of liver disease, but so is hepatitis C, hepatitis B, genetic liver diseases, and autoimmune liver diseases. Even celiac disease can make a liver look fatty when it's not treated appropriately with a gluten-free diet. So there's still many conditions out there that may make a liver look fatty, but it's not always obesity.
So how does excess weight lead to fat accumulation in the liver?
I think the answer is lifestyle. So what got someone to have a fatty liver or obesity tends to have the same common root. So it comes down to nutrition and whether or not someone lives an active lifestyle or not. That's the best way those two are connected. But in addition, we know that when there's liver fat present, that can stimulate a hormonal cascade that can perpetuate weight gain. So liver fat on its own can lead to liver insulin resistance, which can further compound the pancreatic insulin resistance that's also developing. And the two together can almost propagate each other, leading to further weight gain.
So it almost sounds like a feedback loop, one causing the other and then causing the other again.
Correct.
Can obesity-related liver disease lead to more serious conditions like cirrhosis or even liver cancer?
Absolutely, yes. In fact, when it comes to metabolic liver disease, usually we think of people who have cirrhosis have the increased risks of liver cancer, and that's for anybody with any cause of cirrhosis. But we are also recognizing that there's a population of people who do not have liver cirrhosis, yet they have fatty liver disease that are developing liver cancer. So that is a very concerning population that we do not know yet how to screen and identify early.
So how does weight loss impact liver health? And is there a specific amount of weight that's optimal to improve liver health?
Great data to show that weight loss makes a big difference, in fact. So data shows that people can achieve at least 5% of weight loss or 5 to 7% weight loss, they can actually resolve the liver fat. If people who have liver fibrosis, weight loss of 10% can reverse it. So it's exciting. So that is a motivating tool of trying to get people to modify their lifestyle. If they can achieve these weight loss goals, their fatty liver and even fibrosis can even reverse.
So I know so many folks in our audience have tried over and over again to lose weight and have always ended up gaining it back because of those metabolic changes that happen in obesity. Can you talk about the medications that are now available that can help people lose weight sustainably and perhaps improve their liver health?
It's such an exciting time we're in because those medications, or pharmacotherapy as we call it, are fantastic. The data has shown that along with lifestyle change, people can lose a significant amount of weight and keep it off. However, some people may reach a plateau. They might not reach the ideal weight they want to achieve, but if they're metabolically healthier, I think that should be the goal. And I hope that people can accept what's called their new best weight.
I'm so glad you said that because I do think people can have really high expectations for the amount of weight that they want to lose. But what I hear you saying is it's not just about the number on the scale. Even small amounts of weight loss can have a big impact on our health.
Absolutely.
So Dr. Joshi, what are the early signs and symptoms of liver disease?
It's something that people don't recognize early enough. You have to hunt for it. So liver disease is silent. No one knows you have it, and you have to go looking for it. Sometimes people will complain of like an ache on the right upper side where the liver is. And the thought is, as the liver distends from fat infiltration, that there's a little capsule around the liver, and that could ache. So I would say a right upper quadrant, a right-sided ache is probably one symptom that people might have. You'll also see on the internet, people may complain of fatigue, but I think that fatigue is mostly due to lifestyle. Poor quality sleep, low quality food, low levels of exercise. And those are all things that will make somebody feel tired. So there's really no symptoms. You have to look for it. So I think what we're all moving toward, and there's no real guidelines established within North America, but it's likely going to be case finding, meaning people who are at risk, such as people with type 2 diabetes, people with high blood pressure, people with elevated waist circumference or BMI, or who have obesity. Those are the people that will likely need to be targeted for investigations. And the most common test would be a panel of liver enzymes or an abdominal ultrasound. That's usually the first starting point.
So are those tests we would get kind of in a routine office visit, or are they something that we need to ask our doctor for?
Well, I think depending on your history with your primary care physician or healthcare provider, liver enzymes are considered a routine panel for just general screening. So if your doctor's not doing that, then ask.
So on our blood work, what are the numbers that we want to be tracking for liver health? And is there anything else we should be paying attention to?
The lab tests that we typically order when assessing someone for liver health would be the AST, the ALT, the ALP, and the GGT. Those are all acronyms for very long mouthful level names. As I mentioned, they can be elevated, which may signify there's liver inflammation going on, and then further testing would be needed by your primary care healthcare provider. And that would be screening for viral hepatitis, questioning, are you taking medications that could be causing that? And there's a whole other list that the doctor would know to go through. But an ultrasound would then show objectively, is there fat present in the liver? So the diagnosis of MASLD or fatty liver disease is primarily based on the presence of liver fat, which is seen initially on imaging. So imaging is a big part of it, and elevated liver enzymes are another part of it. But just know the liver enzymes may very well be normal, but there could be significant fatty liver disease and even fibrosis present.
So what can people with obesity do to reduce their risk of developing liver disease?
So paying attention to their lifestyle is the number one thing people can do, is that they can maintain it because it gives a longest term benefits. That means paying attention to what they're eating and drinking. And in particular, understanding what are empty calories and not empty calories. So you want to look at cutting back on sugar, refined carbohydrates, products with high fructose corn syrup, or refined flour. That for sure are food topics or food ingredients that should be minimized. And instead, prioritizing with things like protein, vegetables, and fiber, because that will fill the stomach, make people feel more satiated, and even stabilize post-meal blood sugar spikes. And that in particular is really important for people with prediabetes or established type 2 diabetes. Another thing is walking. There's great data to show that walking after a meal can stabilize those post-meal blood sugars. If people are sedentary at work, I do recommend they set their timer and get up every hour and do 10 air squats or go for a quick walk around the office. Simple things like that can make a huge difference in optimizing blood sugar control, which translates into better insulin resistance, which might limit the amount of weight gain and even allow for some weight loss.
So, Dr. Joshi, who should be screened for liver disease?
I think people who have the risk factors, which include type 2 diabetes or prediabetes, high triglycerides, high blood pressure, or elevated waist circumference or obesity. These are the people that we're going to be targeting for screening for if they have metabolic liver disease. And they can see their healthcare provider and get the appropriate tests, which include an abdominal ultrasound or even a panel of liver enzymes. And once those results are discussed, the decision can then be made to have further investigations.
In case you're just joining us, we're here with Dr. Supriya Joshi talking about liver health. And we're giving away a collection of sheet pan meal recipes if you answer our trivia question, which is, true or false, strength training can increase bone density? Is that true or false? Can strength training increase bone density? Put your best guess in the comments and you will get those sheet pan meal recipes delivered to your Facebook Messenger inbox for free. So Dr. Joshi, what are the current treatment options available right now for liver disease?
Well, for liver disease, we actually have very few things that we can prescribe. And that's because there's a lot of great data coming out, but they're still in clinical trials, and they're not yet approved or licensed for treating fibrosis of liver disease from fatty liver as of yet. Right now, there is one medication that's listed. It's not coming to Canada, but there are lots of other medications that are available for obesity, type 2 diabetes management. And we're realizing the same medication can even reverse liver fibrosis and reverse fatty liver disease. So it's definitely a very exciting time ahead. And there's even new medications that can reverse cirrhosis. And that's preliminary data that just came out last week. So I think the future looks very exciting and very bright, as I do tend to emphasize to people, lifestyle is the most important thing. But for those who need medications, we will have it for them.
So what steps should someone take if they suspect that their liver health may be compromised?
I think if somebody already knows that they are gaining weight, they have prediabetes, their blood pressure is elevated, which they can check at home or in a pharmacy or at their doctor's office, or their blood work shows abnormal liver tests, then that's something worth discussing with their healthcare provider to ask the question, do I have a liver problem? And if so, the appropriate investigations can be arranged.
So are there specific types of exercise that are especially beneficial for people with liver disease?
When it comes to exercise, I definitely recommend a combination approach. First of all, just moving your body, because most people don't move at all. Most people in North America do not meet criteria or the guidelines for minimal exercise. So the published data suggests 150 minutes a week of moderate, intensity exercise. And it's a very loose term, because what does that mean? So at a very basic, I want people to walk every day. I know there's a whole 10,000 steps a day gimmick that came out, but it actually has a lot of truth to it. And I know it can be hard to get 10,000 steps a day, but any steps are helpful and good for health, even 5,000 or 6,000 steps a day. So I do encourage people to wear a metric so that they can at least keep track of what they're accomplishing daily, and then they know what they need to change or modify to reach a better goal. So walking is a basic thing. On top of that, for my patients who are sedentary at work, I do recommend they set a timer. And maybe every hour, every 2 hours, say, oh my gosh, it's time to get up and move my body. Walk around the office, take the staircase instead of the elevator, go for a walk outside, or even do 10 air squats if they're in between meetings, because that's been shown to be as equivalent to a 30-minute walk. But for people that are more motivated, you can do what's called zone 2 training. Zone 2 training means you get your heart rate up a little bit. It's conversational. That means going for a walk with a weighted vest. Or if you have a treadmill, Go on an incline of 5% for 30 minutes. That will get you into the zone 2 threshold, or a stationary bike for 30 to 45 minutes. So walking, air squats, zone 2 training. People want more than that. That's fantastic. And the other really important part is strengthening your muscles specifically. Because after age 35, we all are losing our muscle mass of 1% per year. And our muscles are an organ of glucose and insulin metabolism. So it's not a surprise that for people who don't even have obesity, that we're diagnosing type 2 diabetes and metabolic diseases when they're in their 40s and 50s. And that's likely related to not only lifestyle, but sarcopenia or declining muscle mass. So purposely strengthening the muscle at least 3 times a week is an important thing as well.
We know that so many people view supplements as a key for good health. As a hepatologist, what do you want folks to know about supplements and detoxes?
Ansley, I'm so happy you asked me that question because detoxes are one of my pet peeves. So I understand the need behind that, why people want to detox, but you have to understand there's nothing you can go purchase, consume, and it will magically detoxify your liver. There is no such thing. So I want people to save their money and not purchase such things, but instead also save their money by clean eating. So the true detox is avoiding alcohol, avoiding sugar, refined carbohydrates, processed food and junk foods, and eating real food, good quality food, protein, vegetables. If you're going to have a carbohydrate, just have a healthy carbohydrate versus a processed one. And being more physically active. That is the detox that will improve everything, not only your liver health, but many other parts of your health, including your gut health. So when it comes to supplements, the one thing I do recommend for people living in North America, as most of your audience probably, is vitamin D. Supplementation can help with glucose metabolism and can help reverse fatty liver disease. And I often also recommend with that magnesium glycinate because it's a cofactor for vitamin D synthesis and metabolism in the cell, but it also might help restless legs, can help people have a more calm sleep. So that's another benefit to having better sleep quality as well.
So I'd love to hear your perspective on alcohol, as I feel like the data and the research that's coming out kind of contradicts what we thought in the past, which was that moderate alcohol consumption could be good for us. What do you recommend for your patients?
You're absolutely right. The data has been so confusing, what people have been fed by media and by literature. So we're now learning, and we've seen it for decades, is that alcohol is a toxin. We know that it's a toxin. It's toxic to the liver, but it's also toxic to many other cells and our other organs of the body. So the data shows that no levels of alcohol intake are actually considered safe. Alcohol levels or drinks under 2 drinks a week are what we consider low risk. But in my patients who have fatty liver disease, minimizing alcohol is a main part of their treatment strategy. Because if we're trying to correct a lifestyle, we also want to correct other habits that are leading them to have further weight gain, because alcohol will perpetuate weight gain as well. So it's a very simple way. It may not be simple because people have addiction issues, but it's one method to try to improve overall health.
Last question, Dr. Joshi. What is the number one thing you wish people knew about liver health and obesity?
I want people to know that there is a connection. And mostly through their own, gut hormones, through glucose metabolism, insulin metabolism, and that it doesn't have to be their destiny. And that change is possible, and reversing both issues is possible. We have amazing treatments now out there for obesity, and fatty liver and liver disease is going to hop on board with those same medications, because what improves obesity can also improve fatty liver. But the other treatments are the same. It's optimize the lifestyle. Pay attention to what you eat and drink, the time of day and night you're eating it even, like avoid late night snacking, minimize alcohol. And if you're not having good quality sleep, talk to your doctor. Could you have sleep apnea? So those are other good things to help optimize overall metabolic health.
Dr. Joshi, thank you so much for joining us tonight. This has been such an informative conversation.
Thank you so much for having me.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. True or false, strength training can increase bone density? The answer is true. If you didn't get to answer the trivia question, but you'd still like those sheet pan meal recipes, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.